simply saying, oh, my aching back. Back pain is one of the most common of human complaints, which is why new treatments in the works are raising so many hopes. Our Sunday morning cover story is reported now by Martha Teichner.
Consider the human spine in all its glory. The 24 vertebrae cushioned by gelatinous discs, the little facet joints that help make your back flexible, all the ligaments and muscles and nerves. The spine's elegant complexity is a miracle of engineering, or a curse when something goes wrong.
I couldn't walk. I couldn't bend over. I couldn't lie down.
I'd say, oh, Lord, can't you help my back? It does hurt bad.
8 out of 10 Americans will experience debilitating back pain sometime in their lives. And the most common culprit?
I think most people would think it's the intervertebral disc, whether it's herniated or whether it's just worn and arthritic.
Dr. Augustus White, a professor at Harvard Medical School, has literally written the book on lower back pain. He says the easiest way to understand a herniated disc is to think of a jelly donut.
This is the crust of the jelly donut, and in the center where the jelly is, it gets squeezed out, and that would be the herniated part of the disc.
When what Dr. White calls the jelly gets squeezed out, it presses on nerves, which can mean excruciating pain. Barring serious illness, the first line of treatment may not be what the patient, who's only after a quick fix, wants to hear.
You need to make sure the patient doesn't have tumor or infection. But once you rule those out, you can be confident that you're not going to harm the patient by saying, okay, give yourself 4 to 6 weeks.
Believe it or not, 90% of disc injuries heal themselves after a few weeks, especially with physical therapy. But waiting it out can be torture, and not everybody does get better. So that's where surgery comes in. More than 1.2 million Americans undergo spinal surgery each year. That's triple the number of coronary bypass surgeries, nearly 4 times the number of hip replacements. Approximately 300,000 of those back surgeries were spinal fusions, where vertebrae are joined surgically so they can't move. They're often held in place permanently with metal screws or rods. For many patients, surgery is the only answer, salvation, but for all too many others, it can be a nightmare.
Most your pain on the right side?
Which brings us to Dr. Kevin Pauza.
So I spent decades treating patients who've had surgery. Patients would do well for a year or 2, and they'd always come to me and need more help.
Dr. Pauza is a founder of the Texas Spine and Joint Hospital in Tyler, Texas. And in his experience, fusion was usually the wrong answer.
The spine's made to be a structure that bends with every movement that we make. And if we immobilize a segment of the spine, the adjacent segment breaks down. That's known as the domino effect. So my thought was, can we do something to that disc so that we don't have to fuse it? Can we bring that disc back to life?
And that's the headline of the story. Imagine a procedure that repairs and regrows discs, that doesn't involve spinal fusion, that's no more than minimally invasive outpatient surgery.
I'm going to go to the direct center of your disc.
Pauza's inspiration came when he thought about how an ordinary cut heals.
What heals a cut is something that's very simple. It's 2 products that are in you and I. They're in everybody.
In our blood plasma, they're called thrombin and fibrinogen.
For the cut to heal, the 2 components come together and they make a substance called fibrin.
When the 2 components in concentrated form are injected into the disc through a kind of squirt gun Pauza invented, just like epoxy glue, they combine and become fibrin.
And it's traveling through the disc, permeating all the tears that exist in the disc. And then over time, it starts to become firm.
Injected into the damaged disc, the compound acts like a sealant, filling cracks and crevices, and eventually allowing the disc to regrow.
that's exactly like a disc. So if one were to look at that under a microscope, 2 months after we put it in the disc, it would look like normal disc material. So it allows our degenerated disc to turn into a young, healthy, normal disc. Are you comfortable, Rusty?
Yeah, so far there's
Rusty Templeton is typical of the failed fusion patients Dr. Pauza sees. He had his surgery in 2008, but the pain came back and was agonizing.
I'm going to return your discs back up to the height that they were when you were a teenager.
Templeton is given a local anesthetic. The procedure takes about 5 minutes. There's no incision, no hardware.
Did you feel that pressure there, Rusty? Okay, and your disc is now back up to a normal height.
Typically, at first, patients feel discomfort.
Some patients even say, gosh, I wish I never had this done. And then several weeks later, the patients just turn a corner. And we tell them that they can expect that there'll be one day where they have pain, and the next day, it'll just stop.
Pauza is hoping for Food and Drug Administration approval of the procedure by 2015. Phase 3 clinical trials are underway now at 20 sites around the United States. Dr. Pauza has successfully treated more than 1,000 patients in his private practice.
We started treating the first patients approximately 5 or 6 years ago, and the success rate is approximately 86%.
So how did Rusty Templeton do?
my pain before was at least a 10.
And 2 months after the procedure?
It's still around a 5 because I have underlying issues, but I can lay down now. I don't sleep in the recliner, so things are better that way. I can, walk around. I can drive where I couldn't drive before.
The pain level I had before the procedure was probably around 6 to worse 8.
Christopher Joseph was in a car accident. How was his pain 2 months after the procedure?
Right now it's at 0.
Is this some wild and crazy idea, or is this something that really has promise?
I think it does possess incredible potential and therefore promise.
Dr. Michael DePalma is a spine specialist in Richmond, Virginia. The North American Spine Society has just published his paper on the latest experimental therapies involving disc restoration.
Stem cells are something that's being investigated to replenish cells within the disc by injecting them into the disc directly. Injecting growth factors, which are proteins to try to stimulate repair of the disc, have also been evaluated and investigated.
DePalma is involved in 4 different FDA trials of the new procedures and believes these so-called biologics are the future of back treatment. Based on the results so far, he thinks Dr. Pauza's fibrin sealant offers the most promise. If Dr. Pauza pulls this off, even if it's 50% successful with someone, is that significant?
It'd be huge.
And then there's the cost. Compare spinal fusion and fibrin treatment.
Treatment for a fusion, and this is the hospital fee, typically is in the $100,000 range, not including the physician's fee. Again, we don't have a set cost for this treatment yet, but it's approximately 95% less than the cost of a fusion.
Pauza expects it to be widely available within 5 years.
It's the first time in history that we've been able to cause new tissue to grow within the spines. This procedure is the procedure that really the world has been waiting for.
Is it? The procedure is only for back pain sufferers with specific disc problems, but there are a lot of those, and Dr. Kevin Pauza is absolutely sure he's found a better, safer, cheaper way of improving their lives.
It's a little bit easier than surgery, isn't it?
Oh, yeah.
You did great.